In terms of my scope of practice, the most common conditions that I treat are all those of the soft tissues of the knee joint. The knee joint itself is a fantastic structure that has bony, cartilaginous, meniscal and ligamentous structures that function to enable the knee to work in the best way possible. Secondary to trauma or degeneration, those structures can become injured or damaged and over time then cause symptoms in that patient, and those symptoms can include pain, instability or even an inability to trust the knee. And my job is then to work out what exactly has happened to that knee joint and correct the injured structure as appropriate. Often patients can heal themselves with good physiotherapy, and other times when there's an injured structure that requires a repair or indeed a reconstruction, that's where I can help. One such structure is the anterior cruciate ligament, which is a ligamentous structure within the knee joint that stabilizes the knee when particularly performing rotational or pivoting movements. And that can be either during sport or indeed people's normal activities of daily living, particularly if they do practical jobs. That patient can then present with symptoms where they don't necessarily trust their knee and the knee feels unstable. And then on clinical examination, once that laxity has been proven and correlated to imaging findings, then treatment plans can be actioned appropriately. Treatment plans include physiotherapy, which is strengthening the quadriceps and hamstring musculature apparatus. And sometimes if that does not work and the patient is still complaining of symptoms of instability, the anterior cruciate ligament can be reconstructed. There are a number of different ways to do this, but one of the most common ways is to harvest the hamstring tendons in the inside of the thigh or the back of the thigh, and then that is placed where the ACL would sit within the knee joint, and then the patient is rehabilitated post-operatively. The initial priority is, once the wound is healed and the patient is safe, is to require full extension of the knee and then to increase the range of motion in the flexion plane, followed by range of motion exercises and power exercises so the quadriceps and hamstrings can be made as strong as possible to support that knee. After approximately 9 months post-operatively, most patients that can then return to sport, which is primarily the aim of the operation for those who have done so because of sporting injuries, and for others it's then back to a manual job where they may require that knee for their normal function.